So this diagram and the next slide is the whole theoretical framework of holism. Now, when you show this to people, I'm showing it because see how confusing and complicating it looks? Because really, if you look at the key theme in this yellow circle is awareness of relationships. But the top bit, the meaning of holism, if you really break it up, it's not so hard. Here's the meaning of holism. That involves the components and the relationships between components. The components are external or internal that we listed on the board before. So really that blue section at the top of the chart represents our conceptual understanding of holism. The bottom bit in orange, the third bit, is the framework of holism. The framework has got to do with our educational background and training. So in our traditional training, we have a biomedical education. You know, from my experience of my education, there was a biomedical, and when I talk to patients about it, practitioners, not patients, they say the same thing. And there's also a holistic philosophical element in our education. Is everyone happy with that? So you've got two broad categories of education. There's a biomedical and a holistic philosophical, and that will apply to nearly all professions, I would say. Some more emphasise one more than the other. In regards to osteopathy, it's our individual, but you could substitute this for naturopathy, chiropractic, physio, medicine. If you look at our individual practice, there's two types of things we learn. There's learning facts and categories of knowledge. You might say that's the knowledge requirement. And the second component is learning to understand the relationship or the interrelationship between those facts and categories of knowledge. Does that make sense? So you can learn all the facts, but how do you relate them? We usually learn them like, here's the low back, here's all the muscles, here's all the ligaments. We don't teach it in a way that relates all. So you could do it simple as this. Well, here's the sacrum, here's the innominates. The sacrum has a nerve supply that links you up S2, 3, 4 with the bowel. So that's a relationship link. There's also a link from the bowel to the thoracolumbar area, to the lower bowel. So you're starting to teach the anatomy and then relate it. So that when someone comes in with a bowel issue, if you're a practitioner that just treats musculoskeletal system, at least you're thinking about the links between the musculoskeletal system and the bowel. And you may not be able to treat the bowel directly, but you can certainly articulate the spine, free up the sacrum, improve symmetry and balance, which may indirectly affect organ function, if that's a relationship is in trouble. If they need surgery or they need nutritional advice to help balance it, then the naturopath or the medical practitioner will be looking at those relationships and restoring balance to that environment so that it's okay. Does that make sense? So it doesn't negate anyone else's treatment. But you could have 10 people with the same issue, and one might respond from musculoskeletal or mechanical treatment, one might need nutritional advice, one might require more holistic relationship management in order for them to get better. So the success is not dependent on the practitioner, it's dependent on what's actually wrong and which practitioner can address those relationship imbalances the best in this individual case. Everyone happy with that framework? So you've got facts, categories, and you've got interrelating the facts. You've got the biomedical sciences and the osteopathic sciences. I've just used those two broad terms because the osteopathic sciences include philosophy, principles, and assessment and treatment methods, and that's general and regional. Would you agree? You've done osteo. The biomedical sciences, all the biomedical anatomy, physiology, all the systems that you need to know. And all my participants said you absolutely need that. They didn't see a difference between the two, holistic and biomedical. They said biomedical is a part of holism. It's not and or, this is a part of. But you can practice it in a reductionist way or a holistic way. They'd like to see the holistic way. Now, when I asked my participants, what helped them the most in education to learn, it's basically these facts: learning the relationships, holistic general assessment, and the philosophy and principles. They were the three elements they said they did not get very much from their education, unless they had an individual practitioner or lecturer who taught their medical system in an interrelated way and could integrate it as they went, who implemented philosophy in practice. So the things that were actually helped them the most were the least emphasised. They said they were taught about it earlier on in the course. They were taught about the philosophies, and then because of the emphasis of the biomedical, they just shoved it aside. They did not implement it. And if you think about it, how long does it take to master all the biomedical stuff? It takes years. We learn it at the start all the way to the end, and by the end we're starting to get it in. We're learning it after 5 years of training. If we're learning about the philosophy and the relationships and then we just toss them aside, they're conceptually present and then forgotten about, and they're not practiced. So you get out the other end thinking, I haven't been practicing 5 years of working out how to relate it all. I've only been practicing knowledge.
Our history and principles was in the, I want to say, first year.
Yes.
And then we never retouched on it at all. It almost needs to be, well, you've got this concept here that you have no idea how to use in the first year. And then you get everything into it. You need to come back to that and put it back into the
And what
side.
the participants in my study said is they had to get that after. If they were unlucky enough to not get it throughout, they had to work it out afterwards.
Yeah.
And they had to work it out because they wanted to help their patients, right?
Yeah.
They were getting stuck by following the textbooks and the symptomatic model. They got confused and lost and wasn't explaining it. Patients are not textbook, was the words. They had to then stumble through and suffer health crises in order to go back, and they gradually went back to the philosophy. They talked to other people, they read books, they started to sort it out, and they started to add back, and they came back to holistic assessment. Whether they were conscious of it fully or not, they ended up having to expand until they got back to a point where they could go, oh, I can start to see some of these other links. Now, a lot of them couldn't explain it, but they could feel it. They went, one guy said, I don't know how to explain it, but I just listen to my clients and I treat not just the symptoms, I treat these other areas. I don't know why. And doctors just send me patients go, look, I don't know what he does, but it works.
He does it.
You know, and you don't want to step on doctors' toes. You don't want to treat the same way because they're doing a specialty job. You don't want them to. You don't want to treat. We end up becoming biomedical osteopaths, biomedical naturopaths. We all end up getting stuck in the same system. Whereas you want other practitioners to say, oh, go and see so-and-so. They've got a really interesting way of looking at it. They'll be able to pick up some other things that I might not have noticed. I'll deal with this part and they can. So you work together. You start to see how people can help each other. It works much better. But because of that emphasis on one and it's not carried through a course, you don't get to put it into practice. And it takes time. When I was teaching the massage and medial students, I tried to implement the philosophy right from the start. And when we did anatomy, when we did palpation, I taught them the anatomy, and then I went through and did a layer palpation through all the anatomy. I said, here's the landmarks. Imagine you're the muscles. Imagine you're putting your palms where the origins are, the fingers where the insertions are. Feel the overall texture of the muscle, then go cross fibre and actually feel the detail. So I got them feeling generally and detail. I did a whole general feel, then I did a regional feel. So we went through all the anatomy again and made it an assessment process. So instead of just poking at bits, they actually, instead of just poking at a joint here or there, they actually got an overview of the head, the neck, all the way to the pelvis. They got an overview of each different muscle group. We talked through the anatomy as we walked our way around the anatomy, we talked about what anatomy is under our fingers. So rather than having to remember the anatomy then go find it, we just taught them a process and we said, now we're walking along the clavicle, here's the SC. What do you notice? What's the clavicle feel like? Is it hard? Is it soft? We started to get them to feel the texture and the symmetry. And then we got to the AC roll, move it a bit, so it takes the symmetry in motion. And then we went through all the muscle groups, imagine them being a supraspinatus and infraspinatus. And I get them putting their hands in line with the origin insertion, so they were reinforcing their anatomy and feeling it at the same time, so it's not just in their heads. And when you do that, you end up coming out going, wow, I just got a really detailed shoulder assessment, then you add in all your movements as well, and I also know how it relates to the rest of the body. And then from that, you realise that you're feeling, as you go down and say the lats, you're finding that, oh, there's some blockages in the back and pelvis, and that means that shows me another area I need to have a closer look at and then explain the relationship with the shoulder. So there are ways you can teach that make all this stuff clearer instead of just bits and pieces. So And it reinforces stuff. Now, the middle part of this diagram is about the practice of holism. The reason I'm talking about it last is because if you've got a good concept and you've got good framework in your education, that opens the mind to those possibilities, then you can practice it. And to practice it, you've got to have a holistic assessment, which informs your holistic treatment. And it also informs your holistic management options. Who else you can send to as part of your rehab team to help that person get well at the least expense, the most benefit. You know, you don't want to send them to 10 practitioners that are all treating bits. You want to send them to the people you know are going to treat them as a whole person, and that's the beautiful network of practitioners. But assessment itself consists of what you call actions and responses. Actions are your assessment processes. So you learn how to take a history, you learn how to observe, how to feel, how to motion test, and that special test are the main categories. But you've got to be able to observe responses to those tests, because people do the tests. Like the amount of times in clinic, I'd have patients that have shoulder problems. The students would go and they do a full assessment, they do all the bits. They come out and they start treating, right? And they go, nothing's changing, it's not budging. I go, okay, did you do this? Yes. Did you do this? Yes. Okay, so I go back in with them. I'd say, let's start again. We'll look at the person, and it always took time, but we had to do it, or we'd skip gaps. And I'd say, all right, posture, what do we see? Oh, that's up and that's down, and this is doing that. And we'd talk our way through the whole body, and the student would be going, I saw absolutely nothing of that. And then we'd go through the feeling, and they'd go, I didn't feel any of that. So, well, what did you feel? And I didn't have any results because they didn't pay attention to what they actually saw. And so once they saw the links, then you'd have to integrate it and explain it for them. Once they had the explanation, they could see the links, so they'd go ahead and treat, and then suddenly that shoulder would improve because they've got the whole link from the pelvis to the shoulder. But then the second problem I encountered was they'd get all of that, they'd understand it, and then what happened next was they still couldn't get a change. So I had to come in and I'd watch what they were doing, and it'd be awkward. The movements would be awkward, so I'd put their hands on the sacrum, hands on the ribs, and I'd get them to actually hold the relationships. It's like getting two people to talk. You've got to make sure they're talking to each other while you're treating, right? Because if they're facing the other direction and they're going higgledy-piggledy, they're not communicating. So the practitioner's role is to get the tissues to communicate. So you're finding what's in trouble, what's healthy, and you're getting them to talk. And I have to put my hands on and actually move with them until they felt the connection. And then they were right. But when I took my hands off, they'd roll around the problems. It's like there's a rock there and they're going around the rock, they're not moving with the rock through it. It's like digging a shovel under a crowbar under a rock, and they're wiggling the end of the crowbar but nothing's happening to the rock. You actually have to use the leverage to actually move that rock a little bit, get it working into the bits from the health to the problem. So there's all these issues that come up, but they come up as part of the process, and as they mastered each of those stages, they become very good practitioners, treating things that a lot of people with twice their training weren't treating. So it's interesting. But assessment processes, you have to observe the responses, but you must look at the general assessment and the regional. And see, in training there was so much regional that forgot about the general. They learned of it, but didn't carry it through. And so one of the participants said, we learned how to look at posture, but then we just did it. We didn't know what we were doing when we were learning. And then he said, he was a teacher. He was a great fellow. He said, trouble is, you've got to be able to see the trees. Was it the trees for the forest? Wood trees.
Yeah.
You've got to be able to see the wood from the trees.
Wood, yes.
That's the way. And he says the trouble is, when the teachers haven't got there yet.
Yeah.
So it's, and here's a teacher himself, so it's interesting. So you've got both general and regional, and when you're looking for responses in the body, you want to look at what's healthy as well as what's not, because that gives you the contrast, and also shows you, I talked about water flowing through a pipe and hitting the problem. The health in the body tells you where the body's already trying to work and where it's getting stuck. The problem just tells you what's interfering. If you're aware of both, you can actually start listening to where the body will tell you where to work and when, if we listen to it. But these are all little steps and stages. And when you look at health and dysfunction, you're looking at meaningful clues to primary problems. So you're looking at tissue needs, ART. and the secondary adaptive problems. When you're looking at treatment as well, holistic treatment, there's the patient wants and the tissue needs again. So you've got to be able to look at both, because patient wants, again, symptoms and that relationship between symptoms and tissues, and the what else links to your awareness of the whole person and the holistic assessment. And then when you're treating, when it comes down to this final end of the diagram, when you're treating, you can choose to treat a few different ways. You could say direct treatment and indirect treatment, and there's a few meanings for that. One way of direct treatment could be that if you're treating the lumbar spine vertebra, you can directly articulate it, for example. That would be direct treatment. Let's say you were trying to influence organ function. Indirect treatment might be working through the spine, so you're articulating the spine whilst being mindful of the nervous links to the bowel. So you're thinking of bowel, nerve, spine as you're treating, like that whole package, not just the spine with no relationship link. But there's also in osteopathy, indirect and direct, meaning direct treatment is more mechanical treatment and indirect is more listening to the body's rhythms and going with the flow. So you can use it in two different contexts. But in both cases, whatever you choose to treat, you can do it with mindfulness of relationships or oblivious. That's the choice. And that mindfulness makes the big difference in treatment. We had a case, this is a classic example. On one of the horse rides, we went on, used to go away with a team, people. But on one of the horse rides, there was a lady that one of the fifth-year osteo students was treating, and she was like solid and stuck, and she tried everything, massage, articulation, tried every trick in the book, and the body she just was not responding to anything. And she treated the same lady the year before as well. And anyway, we went and looked at the lady, and we got her to stand up, and we looked, and she was doing this. She was slouching. Her whole energy was the energy of a depressed posture. You could see her slouching. She was looking down. She was looking a bit haggard. And we just said, "Oh, you look like you're depressed." And she said, "Yeah, I am." She went, "Yeah, I am." And as soon as she went, "Yes, I'm depressed," you know what she did? She stood up. She stood up straighter, took the load off her musculoskeletal system. So I said, well, go and treat her again, but be aware of treating to lift her emotional state. So she went and did all the same things she did before, but now the patient started responding because her goal was different, her motive changed. She wasn't hammering away at muscles and ligaments which are just following orders. She was actually dealing with trying to treat to lift the person's, make them feel nicer and better and more enlivened, bringing more vitality in. Patient started to sit up and straighten up better. It relaxed her mind and her nervous system because she was aware of cause, not effect, and she felt great. And the next day in the lunch queue, she was one of the chefs, one of the people helping, she was happy and whatever. But it really illustrated that if you're mindful of what's really happening, that becomes what you're treating. You're still treating the muscles and the joints, but you're mindful of that you're helping them emotionally. Happy? And so it makes a difference. And if we're conscious of that, we can explore it and test it and try it in our own practices. The last little bit here is, then again, you've got referral if you need to. And the other thing is facilitators and barriers to holism, which I won't talk about too much now. But so we're nearly there. This slide's just summarising that in a more easily visual form. And I've cut out all the details now, and I've just put the three main categories. So the overall thing here is that the awareness of relationships requires an understanding of the meaning of holism, and it requires an educational framework of holism. And those two things together inform your practice. If you want a holistic practice, you've got to have the concept and the education have to be both there. Happy with that? But this follows on to education. As I've talked about, everyone I asked said, I think 7 out of the 8 participants at least, all of them said this, that the biomedical was emphasised and developed to a high level of understanding, right? That was the emphasis. The holistic integrative elements were not emphasised or followed through. So I'm using those words with care. They were talked about, but they weren't followed through to a practical understanding level. That's that experience that people that have been in the field for years sometimes have, but they might not necessarily be able to teach it. You know, they do stuff and works, but other people try to do the same stuff, they can't reproduce it. We're trying to link the two together so you can develop that quicker. So that has a bit of implications in terms of the framework, in terms of future education and practice. Because one is education should be evaluated to achieve a balanced emphasis between the holistic and the biomedical sides, such that the scales aren't unleveled. Because the biomedical gives you this safety and the building blocks for everything, but it doesn't make it safe without the context. Holism actually gives you the context of why everything is the way it is. Okay? And if you understand that context, it makes your treatment safer, because practitioners then treat what they feel safe treating. They don't have to guess. They don't treat what they're not safe treating. So you could say, look, I don't want to touch your ankle. It's all swollen and fractured, let's say. I'm not going to leave that to medicine to deal with, but I might be able to rebalance your pelvis and settle other things so it heals quicker. Happy with that? So it makes complete sense. So we need to, and this also is going to set up future research, because research will be looking at understanding and treating patients, treating the primary problems in patients with chronic health. In other words, once we start exploring that and start finding it to a level where people can reproduce it, we can start testing the effects on chronic health. And I think it'll help a lot with chronic health, because I did find one study, for example, that explored holistic acupuncture with Western acupuncture, where they're just doing it in an ABC fashion versus a holistic Chinese medicine framework. And one of the things in that said that not everyone wants a holistic approach. Right? That's one of the things from patients. But in the general, it showed that the holistic approach, patients felt more looked after, they felt more empowered, they were cared for. Some people said, but it's not needed. One of my participants said something very interesting. She said, well, if you do a holistic assessment and you don't find anything else, you can go ahead and treat the symptoms and that's it. Because everything else is healthy. If everything else is healthy, gives you a clue to how quick a patient's going to respond, because they're going to respond in a couple of sessions easy. But if the background is stuck and healthy and unhealthy, like in a chronic client, that's going to slow recovery, because there's literally layers and layers and layers of issues the body deals with. So if you want to treat chronic patients well, you can start exploring all these relationships. And you might have 10 people with the same problem, but the relationships setting it up are going to be very different in each case, which means the treatment has to be individualised to cater for those imbalances. Which brings us on to this. I'll just summarise this very quickly. So you could look at chronic health or any health issue in this way. It's like a mathematical problem. So a simple problem might be x plus y equals z. X is and y are the components in trouble, and z is the pain that a person feels. So in this case, it might be that L3 and the right QL are in trouble, causing right low back pain. Happy with that? The second is what I call complicated problems. These are problems that are labelled chronic but actually aren't chronic. They're the miracle cases, the ones that get better in 1 or 2 treatments if you treat them well, if you treat the whole pattern. They might have had a problem for 17 years and they walk out in one go. I saw one guy with 5 years of daily migraines that walked out in one session completely free, didn't come back, because all it was, his sacrum and his bony structure and nervous system was compressed. As soon as we decompressed him, he was fine. Everything else was healthy. That's all it was for him, but other people it's not that quick. But a complex problem is this: x plus y in brackets to the power of 2 over the square root of r3 plus uv over 2 plus p equals z. Now to show you how it works, x and y is the same muscle and joint issue that was in the first case, but it's complicated now because there's a liver issue. Let's say there's a liver issue underneath, causing viscerosomatic reflexes, affecting those muscles and joints, locking them in a particularly complicated little pattern. And then the person's got emotional issues at home, stress at work, complicated. P could be poor nutrition or poor technique at sport. Does that make sense? So if you see that, you could go, well, there's a few different parts of this equation. We could just go look at his technique and sporting technique and deal with that part. We can advise a counsellor or read a good book to help with the marriage and the stress and how to deal with that at home. And then this issue over here with the liver and organs, if you treat that whole thing as a package, think about treating those muscles and joints with relationship to those organs. You might be able to restore balance in sync with the health around it, and suddenly a complex problem is unravelled. It's like unravelling a fishing line, and each knot is a knot in the fishing line. You start at the healthy end and you start unthreading, and eventually it lets go and comes back. So they're your miracle cases. They're the ones that get better really quick. The third case is chronic problems, and they're multiple equations on the whiteboard of health. So in other words, you might have many layers. One could be one equation, you'd release that, the next week there's another layer, and there's another layer. So many problems in the bucket of the personality. If you just deal with the same engine wiping treatment, just deal with the same thing, you're dealing with the same problem week after week after week. But if you clear a whole equation, the next week the next level comes up, and then the next level, and they might have 100 knots in their fishing line, or they might have 100 clots in their pipe, right? And each time the health is clearing one, and then every time they're getting a little bit more healthy, and eventually they get to the point where there's more health in the body than disease, and it starts to start feeling better, and the body's working together a bit more, and things start disappearing. And then it might take you years for some people, but I used to see people in the massage clinic when the students started treating holistically. They had patients that had been coming for 2 years, starting to get improvement in a matter of months, whereas they hadn't got any change after 2 years previous, just by dealing with the layers and working with the health. So it's like, yeah, many knots in a fishing line, many weeds in the garden. You can't just mow the lawn. It looks good for a week, then it all comes back. You've got to start pulling up the bad things and planting the good things. Is everybody happy with all of that? Does that all make sense? Yeah. So that sort of summarises the holistic model in quite a bit of detail, and it should set the stage for later things. Because when we're talking about other levels, as I said, they still have ART, mentally, emotionally, and so on. All right, I'll leave it there. I'm going to add one more bit. So it is working. If I can get you to stand up, this is a practical example of ART. Okay? This works really well. So to finish with, I'll do this. What I'm going to get you to do to test this theory out, and you can see for yourself if it works, is I'm going to get you to imagine you've got a problem in your body in the right liver area, rib cage. So what I want you to do is to side bend your body, twist it a little bit, so your posture's really crooked and off balance, right? Now just placing so we're basically creating a problem that everything else adapts to. What I'm going to get you to do here is just say to yourself, where do you feel discomfort in your body? Just ask the question. If you're not feeling anything, walk around and imagine how you'd feel at the end of the day after about 8 hours of walking around all day in the shops. Where would things start to ache? So we've all created the problem in the same spot. Where do you feel it? So where do you feel it from?
In the neck.
Neck?
Right, SIJ.
Are you feeling it a little lower, down?
Mm-hmm.
Notice how both of you are feeling the pain, not where the problem is, and you're both feeling it in different areas. Mm-hmm. Okay, you can stand up again. I've done that in groups of about 100 people in the room, right? And if you ask for to put your hands up, if I say, how many in the room feel pain where the problem is? Literally you get 5 out of 100. And then the rest of them are all getting pain in different parts of the body. Some head, some neck, some shoulders, some legs, knees. Why do they feel it in different areas, do you think?
Is it all different?
You are all different, but you all adapt to the same stress in different ways in your body. And 2, the second thing is, you've all had different past traumas in your body from the past. And when your body tries to compensate a different way, all of a sudden, it can't go there anymore. It can't go one way, so it has to accommodate it differently. So the collectiveness of what you've been through in your past, together with how you adapt to the new stress, affects your body in a certain way which causes pain in other areas. But very rarely is the cause of the problem the part that's painful. And then the second one to do that So I'm taping it. The second way to do that is if you imagine you're like a bike rider and you extend your suboccipital area, neck, throw your neck forward, then bring your posture back so that your weight bearing's even. So you might have to bend back so you level out. And walk around like that. That's another example. But I feel it in the legs and knees and whatnot. And then you can relax. So again, where did you feel problem? The problem started in the neck that time.
Yeah.
Where did you feel it?
It was the low back.
Low back, where did you feel
Low
it?
back.
Low back. So out of the two of you, you both felt at the opposite end of your body. So the next question is, if we were just treating symptomatic tissues, how many of you would get better? None. And
Not
that's
for
what
long,
the
even
reason.
Yeah.
If you do research on that, that's why it doesn't work. Because you've just proven practically how one area affects the other.
Yeah.
So you can try that at home in different ways and it shows that relationship very clearly. Alright, that'll do.